Okay, Dr. RGB here, and here's a video that's on a medical topic, which is inflammatory arthritis, or autoimmune arthritis. Our bodies have a immune system to fight off things like bacteria and parasites and different types of infection. But we also, unfortunately, occasionally have that system attacking us. And these are called autoimmune diseases. The autoimmune diseases, the most common type is probably rheumatoid arthritis. And in that case, the immune system is attacking the joints. And causing them to become inflamed. There's other types of autoimmune conditions. Psoriasis is an autoimmune condition, and so that can go on to psoriatic arthritis. And also, there's also some other autoimmune conditions. Childhood diabetes is considered an autoimmune condition, and multiple sclerosis is also considered a autoimmune condition. And all these things are some part of the immune system that is attacking the body. In the diabetic, it's attacking the pancreas. Multiple sclerosis, it's attacking the nerves. But like I said, the most common type that people are aware of, like I said, is rheumatoid arthritis, where it attacks the joints. Now, we fortunately have medications that can block this autoimmune attack. You can see on TV a medication called Humira. That's an injectable medication. There's also a pill called methotrexate, which is another very common medication for rheumatoid arthritis that many people take. So, basically this inflammation causes damage to the joint surface, destroys the cartilage, and causes a lot of discomfort. In advanced cases, it'll also cause some damage to the bone. So you see people with rheumatoid arthritis with problem with the joints of the hand, where the hand becomes disfigured. In advanced cases of arthritis of the joints like the shoulders and knees, it'll actually eat away the cartilage. So now you develop osteoarthritis of those joints because of damage to the cartilage. In general, with people who have rheumatoid arthritis, they want to try to take care of the joints as best they can, because any injury to the joint can cause the inflammatory process to start up. I had a bout with inflammatory arthritis in the past, and I accidentally broke a toe. Well, that caused my whole foot to swell up and become inflamed. So injuries can cause inflammatory response, and then this inflammatory response kind of turns on the arthritis. So trying to avoid any major injuries is a good idea, I should say. On the other hand, a little bit of exercise, though, is good, because exercise suppresses the inflammatory response. Again, I told in a previous video where me and my wife used to go out on long walks. Since both of us had some inflammatory arthritis, it wasn't the most comfortable thing in the world. But we noticed the next day that our arthritis was very much calmer. We had a lot less pain the next day. So the exercise that we did, going for the long walk, helped to suppress the inflammatory response, and so we had less pain afterwards. Also, people will notice with the inflammatory arthritis is they have to be careful about their diet. If you eat a lot of junk food, you're going to pay for it because your joints are going to hurt. So eating a nice, good, clean diet with good, healthy food is important for somebody with inflammatory arthritis. So we advise people eat good quality meat that's low in fat, lots of fruits and vegetables, whole grains, and avoid the junk food, especially foods that contain a lot of sugar and fat, because those are going to set off your inflammatory responses. The other thing that you may find is that a gluten-free diet sometimes is helpful. The reason for this is not so much that the gluten is so horrible, it's just that gluten is a protein that is not broken down very well. And so normally when you have a protein that you take in, let's say beef, it's broken down into what's called amino acids. Amino acids are single molecules, and protein is made up of a chain of all these amino acids. With gluten, it's broken down into what's called peptides, which is basically short chains of amino acids. And these things can cause an inflammatory response. So, what I've noticed in the past is if I have a big bowl of pasta, I wind up with my arthritis giving me trouble the next day. My wife also has inflammatory arthritis, and she notices if she eats a lot of corn, she gets an inflammatory response. So sometimes you can find that there are certain types of food that will bother you, and sometimes it's not a bad idea to try to avoid those. But like I said, I encourage fruits and vegetables. I encourage a little bit of exercise, and hope that helps. If you do have inflammatory arthritis, hope that helps you. And hopefully you see a doctor and get on some good medication. Okay, take care, guys.